because it can be challenging to learn with a newborn in your arms.
Yeah.
So my team has a mix of CLCs and an IBCLC RN. So it's very much the visualization that an athlete would do to prepare for a race or a swim. They are imagining how their birth is going to go and how their baby is working with them. And if you don't understand your options, you don't have any.
Welcome to the Primal Parenting Podcast, where we apply ancient human developmental needs to the modern world. The best parenting advice is encoded in your DNA. Primal Parenting will show you how to raise a thriving child, because thriving is a human right. Welcome to the Primal Parenting Podcast, where we bring you the real science so that you can make informed parenting decisions that are in line with your true values and that don't suppress your instincts as a parent. Your God-given instincts are there for a reason, and they are consistent with mountains of and decades of science, especially attachment science. Attachment science and the last 50 years of research around children's mental health and neurological development has shown us that there are 5 baselines that human beings need as social mammals. And those 5, in order to grow the social and emotional brain, which is kind of the signature characteristic of being a mammal, that helps grow those parts of the brain to their fullest potential. So our full human potential is reached through attachment. I'm Angela, your host of the Primal Parenting Podcast, and I call myself the attachment activist because attachment is, I feel, being attacked in our society, is being compromised in our society, and we need to embrace our attachment health. It's part of one of the major parts of what makes us human, and what allows us to reach our full humanity is our attachment. And those 5 baselines are attunement, and that is the root of the attachment relationship that builds the attachment over the first year or so, several years, but especially the first year of life. Attunement, attachment, attunement. That's number 1. Touch is the second one. It is like a fuel. We need affectionate touch. Babies need to be held. They don't even know that they're a separate person from the mom in the first 6 months or so of life. So they are a part of us. They feel they're a physical part of us, and they need that physical touch and physical presence. The third baseline is nutrition or feeding, which is breastfeeding, and then avoiding a lot of the toxins in the environment, the chemical toxins, the literal toxins in the environment, as well as avoiding negative touch, which would create a negative emotional environment, and which also causes negative chemistry, body chemistry, the negative emotions and distress. That's what we want to avoid in babyhood, because the developing brain is very sensitive to distress, especially separation distress, because the survival instinct of the baby is centered around keeping that physical presence close. They don't feel like they're okay unless they're physically with us. And all of these things are just so foundational. And we are often, as new parents, deprived of these insights. So I found it amazing when, as a new parent myself, that no one tells you, for example, oh, you're not going to be able to put that newborn baby down. So you need to prepare for that existence for 3 to 4 months, or what Dr. Harvey Karp calls the 4th trimester. And that has become a term that everyone in this space uses, because the 4th trimester, or that first 3 months after birth, is such a demanding time where a lot of parents feel blindsided by the demands of the newborn baby and the demands of life with the baby. It's not something to be afraid of if you have the proper planning in place for that 4th trimester. So thank you to Dr. Harvey Karp for illuminating the 4th trimester for what it is, because all of the research of what we are as human beings shows us neurobiologically that infants are really like fetuses of other mammals. So if you look at other animals, the human fetus the human baby is born way earlier than other mammals. So a human baby is really, a newborn human baby is really about 18 months premature And that's because of our physical, because we're upright. Basically, when humans became upright, the gestation period shortened so that the baby could be able to come out with a smaller brain, a smaller head to come out through the birth passage, which is smaller since we stand up. So that means that babies are essentially born 18 months too early. And that fourth trimester we really need to give the baby a very stress-free, a very cozy, affectionate, attuned, emotionally attuned, and physically present environment in order for the rest of the brain to grow optimally. So this episode is all about preparing for birth, preparing for the baby. Please share this with any expectant parents that you know, because we don't want them to be blindsided by all of the challenges that can come in that fourth trimester. And we want them to understand babies, newborn babies, so that they can be in tune and can provide all the nurturing and attachment as the attachment system is forming. So today we have Kristen Revere, who I'll introduce in a moment, and she's got incredible expertise for all of the preparation that needs to be done for that fourth trimester period, and including the amazing, wonderful, beautiful, necessary gift of postpartum doulas. Postpartum doulas, as well as we'll talk about birth doulas too, but postpartum doulas especially are the quintessential resource for the fourth trimester. So for this period of adjustment from the womb to the outside world, to the mother's adjustment to becoming a mother, the family's reorganization, the postpartum doula is the expert at facilitating and supporting that. And that is the fifth baseline of human needs, babies' needs, child development needs. And the fifth baseline is community. We cannot do the other four. So attunement, attachment, breastfeeding or good nutrition / natural medicine, and positive touch. And then the fourth one is play. And our beautiful episode with Michael Mendeza from Touch the Future, our fiscal sponsor for this Primal Parenting nonprofit initiative, has an excellent episode about play, the baseline of play and the state of play as a parenting strategy, and play as discipline, as relationship building, as education, nurturing. Play is an incredible baseline. So please check out that episode if you want to learn more about the power of play, and especially in discipline and in the approach to behavior. The play episode will also link here. So those are the four. And then the fifth baseline is community. And that's what this episode is really focused on. Community is support, and you need that support in the first trimester. So please like and subscribe and hang in there until the end of this episode. It's going to be packed with information for preparing for birth and preparing for the support you need in the fourth trimester. But also, if you stick to the end, you will learn the number one cause of postpartum depression, how to avoid it. And you will also get some insiders information from Kristen on how to get all of the help that you need, all the support, all the services that you need in that postpartum period, how to pay for that, how to pay for all of that. Top priority budgeting wise should be support. So stick to the end. And thank you for being here. And thank you for wanting to be an attachment parent, because you're changing the world with your high nurturing care and being able to infuse in your little one all of the security and love and care that they need to reach their full human potential. So an environment, both emotional and physical environment, that is conducive to building your baby's attachment system and helping them to feel secure. And that all starts with the mother and the family and the other support people around the mother, the father, and the extended family. Keeping everyone healthy and happy during that period is the most important aspect of building and protecting the baby's developing attachment system, which is also tied into the baby's developing social and emotional intelligence. So thank you for being here. I'm very excited to introduce Kristen, and welcome to this episode of the Primal Parenting Podcast. Today, I have Kristen Revere, who is an elite certified doula who leads a team of doulas at Gold Coast Doulas. And we're going to explain what doulas are. But Kristen is a postpartum expert in many ways and is just brilliant at bringing together all of the experts that new parents need in that postpartum era, or what we call the fourth trimester, right, Kristen?
Exactly, Angela.
Welcome. Thank you for being here. Thank you for everything you're doing for new parents.
Thank you for having me. And it is such a needed role. And yeah, I would love to start by explaining a bit about the different types of doulas. You mentioned the postpartum doula role. So there are birth doulas, first of all, and we are non-medical support, and we work with clients throughout pregnancy and give resources such as postpartum doulas, physical therapists, prenatal yoga classes, lactation, breastfeeding classes during pregnancy, lactation consultants after the birth. And then we support our families wherever they choose to have their baby. It could be at a birth center, at home, or in the hospital. Now, there are also some doulas that work in certain hospitals and they are employed by the hospital, but the doulas that I'm describing are hired by the client. And then there are also some doulas like our team that provide antepartum or bed rest support. So that is very helpful if a mother has other kids at home and can't get up, then we can do some household tasks and sibling care and get them snacks and food and make sure that our clients are emotionally prepared. We can do childbirth classes or give them any information they need to prepare for their birth.
So fantastic, because I think that parents have an instinctual desire to prepare during pregnancy. I remember being in that place and so many moms communicating to me too, that they feel like they need to prepare. They have this nesting instinct, but it's overwhelming, right? To know how to prepare and what is going to really be important and what isn't going to be important. So since you have all this broad expertise, I'd love to spend some time just on the preparation during pregnancy. How do you determine what type of support to prioritize? How do you help the moms figure out what they should prioritize and what's actually important?
Yeah. And in my book, Support is Your Guide to Birth and Baby, we talk about preparing for birth and baby the way you would for planning a wedding or building a home, other major life occurrences, and really finding out what your budget is, first of all, what your unique goals are. And so, again, like with the comparison to a wedding, it might be photographs or the food. And for preparing for the birth and that postnatal recovery time, it might be sleep is the biggest priority. So hiring an overnight postpartum doula or a newborn care specialist may be the number one need. Or if the goal is to have support in labor, and feel very prepared with understanding the changes in the body, then that could be investing in a childbirth education class, like a hypnobirthing that reduces the fear going into birth, whether it's a home birth, a planned cesarean, a client who wants an epidural in the hospital. It's great for all types of births. And then there's similar classes like gentle birth or Lamaze, Bradley method, there are hospital classes. So we talk about all of those different ways to prepare and how to involve the partner in, that prenatal education. If our clients want to breastfeed, then we highly suggest taking a breastfeeding class and bringing a partner or a family member who might be a support there so they know how to help with the latch, how to work a pump, how to clean a pump, and all of those important things, because it can be challenging to learn with a newborn in your arms.
Yes. And I think that we all had to learn, right, that breastfeeding is actually a skill. We have the instinct to do it, and the babies have the instinct to do it, but we don't have the skill. We have to learn it, right?
Absolutely. Yes. And some babies are, have that easy first latch and there are no problems. I've had different difficulties with breastfeeding with both of my kids. So my daughter was in the NICU for a few days. I had preeclampsia. And so she was given an IV due to her glucose issues. And then enhanced formula, I was pumping, and then eventually was able to breastfeed, but she liked the bottle because that's what she was given. And
Right.
so I sought help from lactation consultants, even having taken, again, a breastfeeding class. It was a lot different than what I imagined that initial postpartum bonding would be like. And so I needed to get an IBCLC to come to my home and help with some of those challenges. And
Okay.
so,
Just so we know, that's the credential for a lactation consultant. Is that what the?
yeah, it's the highest level of credentials. So again, if you're dealing with a tongue tie or something medical like thrush or mastitis, an infection in the breast, then you would rely on, and oftentimes, but not always, their registered nurse. You can go through the IBCLC process without being a nurse, but it's very lengthy, hundreds of hours, they're board certified. And
Yeah.
then there are also certified breastfeeding educators. There are CLCs that are more common, certified lactation consultant. So my team has a mix of CLCs and an IBCLC RN.
Awesome. And the reason that we have experts like this is because breastfeeding is very complicated and it is a learned skill. And there are a lot of things that can be overcome. A lot of times women think that they can't. Oh, well, I guess I just can't. But it's actually, you can. It's just very common to have these hurdles to go through, and you need support and expertise to get through those and to actually learn the skills.
Exactly. Yes.
It's very common to need help.
Exactly. And there are support groups in many hospitals. You don't even need to deliver at the hospital oftentimes to attend a support group. There are La Leche League meetings that are free to attend. And so there are also some virtual support groups that can give information, and you can, some IBCLCs take insurance, do house or office visits, and then you can always go to a hospital and see the lactation consultants there even after you deliver.
Excellent to know. And you had mentioned the different types of birth that you consult on, and you mentioned hypnobirthing. Can you tell us a little more about how that works?
Sure. So with hypnobirthing, it is very mind body focused. So using visualization, affirmations, positive language. So, for example, a contraction, you think of contracting and tension, but with hypnobirthing, they call it a surge. And so you're understanding the flows of labor, and they don't utilize the word pain, it's more discomfort. And so taking some of that fear-based language out of birth and realizing again that people have different goals. And so wanting to support people where they're at. And so that visualization is helpful for them, as well as our clients who want a home birth without any medication, or, have a fear of hospitals, regardless of if they want an epidural or a medication-free birth. They may want some of that support. And it's very partner involved. It's a comprehensive class, so you know all the stages of labor, all the potential interventions, what your body's doing at each point, and how the partner or support person like a doula or family member can be a support.
Okay, so your doulas are some doulas hypnotherapy certified, or who does the actual hypno?
So the instructor would teach couples how to do some of the relaxation exercises together. They do those at home all throughout their pregnancy. And then the doula is able to read scripts. At Gold Coast, all of our doulas have fully audited a hypnobirthing series. Our hypnobirthing instructor also takes birth clients. So some of her clients take the class and then want to have that extended relationship. So, yeah, so it's very much the visualization that an athlete would do to prepare for a race or a swim. They
Mm.
are imagining how their birth is going to go and how their baby is working with them.
So many options to make it more successful to meet whatever goals of that individual parent. It's wonderful. And I love how you focus on taking the fear out of it. It was making me think about what we were talking about before with all of the breastfeeding complications that can happen. We don't want it to be scary. It's really not scary if you understand it and you understand that all of these things have remedies, all of these things have solutions. So it doesn't have to be scary to be aware. As society, we try to just not talk to pregnant mothers about these things because we don't want to scare them. And then after birth, they're kind of blindsided by a lot of sort of avoidable or things that are easy to deal with if you just have the knowledge and know that this can happen and you can just prepare for it.
Right. And if you don't understand your options, you don't have any.
Yeah.
So, as doulas and in our new book, Supported Your Guide to Birth and Baby, we let people know about all of their options, like hiring a car seat safety technician and making sure your car, each vehicle that the baby is being transported, because it may be the grandparents might need a base installed properly, or the partner's vehicle, and making sure that baby or babies are secure in whatever vehicle they're in. And cord blood donation, we talk about that, and cord blood banking, what the differences are. And again, all of the different classes beyond a childbirth class like hypnobirthing, like taking a newborn care class or breastfeeding class, or if you're expecting twins or triplets, a multiples class. And grandparents is one of our popular classes. And we find that our clients tend to gift it to their parents, especially if the parents are helping out the first couple weeks
That's great.
or are acting as caregivers or live in the same town. So they're up to date because, as you know, Angela, so much has changed in safe sleep, in again, car seat regulations, in feeding, whether it's formula or breastfeeding. And so keeping grandparents up to date on even the safety aspects and how to understand if a product's been recalled. And so just keeping everyone up to speed without having those uncomfortable discussions with your parents or in-laws.
New parents really need that extended family support. And the primal parenting that we focus on this podcast is the 5 baselines that we need as social mammals. And the 5th is community, right? So I always say that the other ones can't even be really done well without the 5th one, community, because we need so much support during that era, and that's normal. So what do you say to the moms who are not quite getting that they need support and they need help and they have this very independent mindset of like everything's going to be the same and I'm just going to be able to do it all? What do you say?
That is such a good question, Angela. I mean, don't be afraid to ask for help. And one thing for new moms that is shocking at times is that you get all this attention put on you during pregnancy, and it's all about the bump and like how you're feeling. And then after you deliver, it's all about the baby. People come over, they may bring you a meal, but they want to hold baby. The presents are for the baby, and the mother can feel less than, and it's a new role. And so they can often feel like they're missing their former identity. Mm-hmm. And that everyone is viewing them as the caregiver for this baby or multiple babies. And all that they're focused on is, again, holding and gifting the baby. So that mother oftentimes needs to be mothered herself. And in traditional cultures, like Malaysian culture, for example, the care is given to the mom in those first 40 days. And they're pampered, the newborn's cared for, they're given healing, warming foods. and to be able to recover. And in our society, you're supposed to fit in your jeans as soon as possible, look Pinterest perfect, and don't ask for help and just be this Wonder Woman. But actually, we need support, and it's okay to ask for it and even have conversations about what you think you might need support wise during pregnancy, rather than waiting until you deliver and you're already going through those emotions, the hormone fluctuations after birth. And so to have those conversations can be uncomfortable.
Yes. And all of the attachment science that we're so focused on here at Primal Parenting Podcast, even that it is baby centered, but the mom is regulating the baby, and all of that is building the attachment system in the baby. And so the baby's only going to be as well, as regulated, as comfy as the mom is. So really
100%.
it's so important to take care of the mom, or the baby just isn't going to have what the baby needs.
Right. And if the mom is anxious or upset, baby is going to sense that and also be irritable, may start crying, may not sleep. And so you really, I mean, again, putting that oxygen mask on yourself and taking care of yourself so you can care for your child is so key.
There's so much research showing the correlations between the mom's mental health and the baby's childhood outcomes, especially like you mentioned with anxiety and depression. Let's talk about depression a little bit, because it is very common in the postpartum era. What do you think are the most important things for the new moms to understand about depression, how to avoid it, and how to deal with it?
So again, there are many different types of perinatal mood disorders, and I am not a therapist, so I will give a basic overview, but the baby blues can happen certainly in those first several weeks. And there's also a hormone fluctuation at 6 weeks, and when food is introduced, or at weaning, which isn't often talked about. So those things can be normal. Again, that weepy feeling. And if a mother is exhausted, say she had a multiple day induction and she is all of a sudden caring for baby and she is beyond exhausted, or if baby's not sleeping, then the lack of sleep can intensify different perinatal mood disorders. And it can be, I would certainly say, depression is one of the most common ones, but it could be obsessive compulsive disorders. It certainly, anxiety is also very common. And so understanding if your listeners are birthing in the hospital, then the hospital will give you a sheet and you'll be able to understand some different signs. Or if you're working with a postpartum doula, they're able to give resources, but really understanding what is normal and what is not. And again, trying to sleep when baby sleeps, get as much support, maybe consider hiring an overnight postpartum doula or a newborn care specialist to optimize your sleep. And if your listeners are attachment focused, then, you can still have skin to skin. You can still breastfeed and bond with baby, but then someone else can burp baby, change the diaper, do the sleep shaping. So you are getting more rest, but still rooming in with baby.
And we want to always give the parents what they need to be able to meet those demands, which is part of the planning process, right? Again, lining up who is going to come just hold the baby for a few hours while the mom can rejuvenate a little bit and rest up. And that is very protective of attachment, like you said.
Absolutely. And that can make a big difference. Just not, if a baby's colicky or extra fussy and you just need a moment to, sit on your balcony, get some sun and, look at a book for a minute, whatever fills your cup.
Yes.
Just taking a bath, whatever it might be, that really helps you get in a relaxed state and feel more like yourself before baby. Even if it's baby number 4, it still is a rite of passage.
for.
Exactly. There's even more going on and other kids needing you, a partner who needs attention.
That's one of the most important things I think in all of your messaging is that it is normalizing the need for support. Tremendous support is needed. I wish that that moms knew that more going in and prepared better for that. And so I'll ask you also in terms of preparing, because I know that's a big part of the education that you offer and the support that the doulas offer is helping you plan what you need. What do you think that is the most common misconception that parents think they need to focus on in planning versus what is really important?
Getting the nursery, again, Instagram, Pinterest, perfect, and spending all of this time on things that baby may not even need until they're a year or 2 years old. And really, baby doesn't need a whole lot as far as all of the gear. So I think so much focus is spent on getting the room ready and baby showers and registering for all the gear and products. And sometimes baby will not like certain things. So it could be a bottle or, a pacifier may not work well. So you're registering for all these things and or a swaddle, whatever, and those are the lower priced options.
Right.
You get into some of those pricey automated like bassinets and so on. And that is going to certainly set you back financially. So I tell my clients to consider more of the essentials early on for the registry and think about registering for services rather than all of the gear, and focus more on how you can get support. And that could be pre-made meal delivery service. It could be a housekeeper. It doesn't need to be a doula. Not everyone wants or needs a day or overnight postpartum doula, although I think everyone should have one. But you may have different priorities, whatever makes you feel like you've got the support you need.
I think that when baby comes and the nursery's done and everything is aesthetically perfect, the baby comes and then the parents realize quickly that the baby doesn't care about any of that.
Exactly.
You and you are you, meaning the parent, the mom is a limited resource. So support that resource. I personally, from all the coaching, hundreds of moms in the postpartum period that I've coached, I think that is the most where they should put most of their budget is towards support, just like everything that you have laid out so perfectly with your practice, that kind of support. That's what we're talking about. The overnight help, the postpartum, the lactation help, everything, which that it is usually not a cost, but it is costly to have help with the help that you need with the house and the help that you need with the baby and the help taking care of the mom and the family, making the household run. I would put that at the very top.
Yeah, or a diaper service with cloth diapers. They'll, bring them back. And so there's so many different things you can, do based on your priorities. And it's not just about that nesting instinct and making the room look perfect. The baby doesn't care what the nursery looks like. So yeah, I mean, you can have the great theme, but it's not going to matter to baby. Baby wants that attachment and care and support and to have trusted and supportive parents.
Yes, the parents are the nest. The parents are. That's what
Exactly.
they need to understand. Like that's what all the baby is oriented toward. They don't even know they're separate from the mom for what, 6 months?
Right. So true.
So the
So
mom,
yeah, that's my biggest piece of advice is you don't worry about all the things. And if people are willing to gift you items, register for services. There's a site called behervillage.com that allows you to register for multiple types of services, a lactation consultant, chiropractor, whatever it might be. But in my book, Supported Your Guide to Birth and Baby, we talk about how to pay for all of the different services. And so again, you could put items on your registry and have friends gift you, or birth and postpartum doulas and some classes are covered with HSA and FSA accounts.
Excellent.
And now many benefits that are more, I would call them fertility benefits, include birth and postpartum doula coverage. And that could be Maven or Carrot Fertility is a big one right now, Progeny. And so if your employer has a plan like that, then you can get birth and or postpartum doula support.
Oh, that's excellent.
Yeah, and some
We'll put
states
that in the
cover. That would be great. Yeah, and some states cover birth doulas through Medicaid for anyone who has that particular coverage. And Michigan is one within about the last year and a half. And so seeing if your insurance, general insurance at this time does not cover doulas, but there may be some of those self-funded plans that would.
Mhm. Okay. And you can have your registry be focused on get the budget to get your doula that you want, whether it's the birth doula or the postpartum to take care of you after the birth or both. They're very different, right? They serve
Right.
completely different roles.
And I've had some companies in my area reach out, and for the company shower, they all pooled in and gifted postpartum doula support for the
It's so,
family. And
I
so beautiful.
love it. I love that. I'm so glad to hear that more companies are becoming aware of how important that is for the long-term mental health of their workers.
Yeah, they can retain their employees if they're rested and have the support that they need, or if the partner needs to go back to work,
Mhm.
knowing that there's care there.
Excellent. And the website that you mentioned, behervillage.com, we'll put
Yes,
that up too, because that is completely devoted to gifting services, right?
right.
Excellent. I'm so glad that you're bringing awareness around that. And even setting up some arrangements with friends and family or other moms that can kind of help each other, I think is a great way to be a village, establish your village ahead of time as well. To
Absolutely.
go back to the depression that often happens, and the overwhelm and anxiety after birth, what percent of the time, just if you had to guess with your expertise that's so broad, how often is that depression due to just exhaustion?
Most of the time, unless say there's a history of depression and a client is already being treated or had PTSD from their birth. There are so many factors, or maybe loss. I mean, we have a lot of cases of prior loss, and a client then is very anxious throughout the entire pregnancy, and even when they have baby in their arms,
Uh,
there may be that heightened level, and it's difficult to sleep because they might be worried that something would happen to baby. So yeah, I mean, there are just multiple factors that could cause it, but the number one thing is the lack of sleep.
exhaustion and the lack of sleep is the number one cause of the postpartum blues or postpartum depression, wherever the parent falls on that scale. And you mentioned PTSD because, and again, we don't want to scare parents, but we want to prepare you because sometimes the birth experience does inadvertently cause trauma. How should they mentally prepare and practically prepare for those types of experiences in the birth that sometimes aren't avoidable?
Right. So great question, Angela. I would say the main thing, if you don't have a doula, having your partner advocate for you, because sometimes in labor we cannot speak for ourselves. You get to that point, and once you're in transition, it can be difficult to advocate for yourself. And the biggest thing, despite any negative outcome that might happen in a birth, is feeling like you are making informed decisions. Things are being explained to you by your medical team, which could be a nurse midwife or an OB, the nurse, or if you're, at a home birth, then the home birth midwife. But feeling like you have some say in the matter, even if it's a pause to ask a few questions. As doula, we know when things are emergent and there's not time to talk it through.
Mm.
And we also know if there's time to ask a few questions of the nurse and feel like you're fully understanding what needs to be done in that position. So yes, and then talking it through, having a therapist
Mm-hmm.
to talk to. I'm a huge fan of therapy in pregnancy and certainly after delivery. And
Yeah.
now there are virtual therapy options. So you don't even need to leave your home
Wow.
and you can get help. And there are so many support groups for, again, traumatic births or, new mom groups. And you can talk through your feelings and get resources from an expert therapist.
I love that. And I think that a lot of times they go through the birth plan, and the best therapist I've heard, they tell them up front, this is what your ideal is. And if this can't be, then what would you like? So they feel in control of everything. And at the end of the experience, if they go back and it didn't work out, the way that they wanted to in that way, that for their ideal, the therapist explained it to me this way, that you tell yourself, I did get my birth plan because my birth plan was all contingent. Like, if this can happen, then I want it. If not, then I want this. And so you're speaking to that sort of self-efficacy, self-agency, right? That you have control over what's happening to you to some extent. And
Absolutely.
that's exactly what minimizes the trauma if things don't go as you want.
Right. And I like to call birth plans a birth preference sheet because there
Exactly.
are so many things that are out of our control. If you are very stuck on this perfect plan, then things may not go that way and then you feel defeated. But if you are flexible and know that it's up to how you are doing health wise, how baby's responding, and that you have some preferences going in. Nurses love to see a birth preference sheet or a plan to know how to best support you because they don't know you the way your doula does. So they're coming in and they want to know what your goals are, how they can best support you. But if it's a rigid 5-page plan of I will not accept Pitocin, no epidural, like sometimes you need some of those tools in the toolbox to be able to have your baby and avoid, say, a surgical birth that would take longer for recovery.
Do birth doulas statistically lower the rate of surgical births?
Yes. And that is because the continuity of care, that continuous support, they have that relationship all through pregnancy. The clients trust their doula. And the nurse, as wonderful as the nurse may be, they're working with other patients, they're charting, they have so much focus on the health of mother and baby that they can't be the emotional support for the partner, or even if there's a mother-in-law in the room and the client, the way a doula can. And we also support physically and a lot of hip squeezes, counter pressure, labor massage. And we know different positions to try. Say if labor stalls and the OB walks in and says, nothing's really happened in a couple hours. Let's talk about some next steps. Then we can talk through the risks and benefits and alternatives if it's not an emergency to any intervention. So, and then again, that coaching role in labor and supporting the partner so the partner can support the mother is such a big part of it because their bond is so strong and it gets the oxytocin going and the hormones in labor are amazing.
Yes, and a birth doula will help us get the ideal plan, that it will increase the chances that things are going to go the way you want them to go. There's obviously, you can't predict everything, but really having a birth doula is going to put you at such an advantage in having the birth that you really want. So that is definitely at the top of the gift registry, I think, for it should be, or over, the perfect crib or any of the gear.
Exactly. And a postpartum doula can be many things. We talked a bit about overnight support,
Mhm.
but a daytime doula can do some light household tasks, can vacuum. You're not supposed to vacuum after delivering, or, you're not supposed
What
to
is the
pick up
reason
heavy
for that?
things. And so it's all about healing and avoiding bleeding. So if you do too much physically, then you're not healing. And so, yeah, it's just about resting and helping your body recoup. So you're not supposed to lift anything heavy or vacuum in those first few weeks. And so doulas can, get snacks made, or start a crock pot dish, or get, if there are other siblings at home, keeping them entertained, or caring for baby so mom can spend some time with the other children or child, and just being there to process the birth, again, emotionally, or helping to create strong systems in the household and figuring out schedules and how to make these changes work, and what other resources they might need in the community, like a lactation consultant, for example. And then, supporting the partner as well. Partners can get postpartum depression. And
Right.
so
Yeah.
it isn't talked about frequently, but getting
Right.
them resources and help. Or again, if we're seeing something that isn't normal, we will have them talk to the pediatrician, or have them go in to the hospital if they're having, say, excessive bleeding or a fever or a headache, things that are not normal, after calling their provider and making sure they're getting cared for.
Right. And like the tongue tie, lip tie, that's the sort of thing that the doula may recognize when no one else does.
Right. We can recognize some of the signs, but that maybe, they might want to get checked out by a pediatric dentist or their pediatrician, or in IBCLC, lactation consultant, certainly.
That's such a great
So,
example of a simple thing that will solve the feeding problem or the sleeping problem, just that one thing. So if you miss that, you're set up for a lot of angst, right? A lot of unnecessary trouble. So
right.
I think that having the postpartum doula is just it's how it's natural. It's how we evolved as human beings. We had this kind of help around us. It was a grandmother or an aunt, or women in the village, right? That understood and just had all this knowledge, and now we have to hire them.
Exactly.
But
Yes,
we
there were
need it.
always doulas. They were just,
Yeah,
again, part of the community and stepped up to care for moms because they loved it. And now it's a profession, which I'm thankful
as it
for.
should
So,
be. Yes,
yeah,
absolutely. So put the postpartum doula and the birth doula at the top of your baby registry. That is the best gift you can give yourself, and it will last a lifetime, the support that you had during that important time.
exactly.
And the name of Kristen's book, again, is Supported: Your Guide to Birth and Baby. It's so important to prepare. It's the most precious time in your life, and the most important thing you'll ever do is raise a child. So the preparation and support that you need to give yourself is just so important. And I'm so grateful for all the work that you're doing to help parents realize the support they need and get the support they need, and within their budget, everything. It's like you've thought of everything, Kristen.
I've been doing this work so long that I know what my clients need, and not everyone can afford to hire a doula. And so we wanted to reach more people through the book and our online course, Becoming a Mother. So get out of, our circle in West Michigan and be able to help more families.
You have done so. Excellent. And do you want to talk about your podcast as well? You have a podcast called Ask the Doulas, and the book.
Yes. So Ask the Doulas, we started that podcast back in 2017, and it's been around a while, over 250 episodes. And I interview experts in the birth and baby field, like yourself, and mental health therapists, pelvic floor physical therapists, anyone that you would need to add to your dream team. And they are short, 30-minute conversations, and also transcribed into a blog. And my book supported, that Alyssa Veneclaz, who's a sleep consultant, co-wrote with me, and we're both postpartum doulas, and I'm the birth doula of the pair. And so we have that available in so many options. It is on Audible, which we narrated the book ourselves.
Oh, lovely.
And yeah, so if you consume books that way, we also have it on Kindle, and it's hardcover and paperback versions. So many different ways to get the information you need or gift that to someone for a baby shower gift.
I love that. Thank you for sharing all of your knowledge with us. And we'll put a link to Kristen's book, Supported, Your Guide to Birth and Baby, in the show notes, as well as to her podcast, Ask the Doulas. And I just really appreciate everything that you're putting forth, because it all helps the parents create an environment for attachment, for healthy attachment with the baby, when everyone's supported and encouraged, and the myths are dispelled about spoiling baby or being independent. And all of those myths are aside, and we just embrace that we need the support. We're not independent. We're not meant to be independent. Baby's not able to be independent. And so the support is just a natural human need, and it paves the way for attachment. So I just really love everything that you're putting out there and appreciate all of your works.
I appreciate you, Angela, and thank you for putting this amazing podcast out, and appreciate you having me on.
Thank you so much. And it's especially important for attachment-minded parents to surround yourself with the support that is in line with your values. So have support people lined up, whether they're coming to help at night with sleep, or whether they're coming during the day to help any interaction with baby. Make sure that they're on the same page with you in terms of avoiding distress and respecting normal, natural, biological sleep of babies, which is going to be interrupted sleep, and they're going to need a lot of refueling. They can't go that long without breast milk, because they have to have that hydration and fuel. So understanding the old myths in terms of baby care versus what we know now scientifically, because of brain development, how we know so much more about brain development, how the baby's brain develops, and using that knowledge and making sure your support people have that knowledge in place, such as no distress around sleep. And so you definitely need people to help with sleep, whether it's just holding the baby for you so baby can sleep on a person that's awake, because that's a safety issue. Falling asleep with baby on the sofa, you want to avoid. All of these negative outcomes can be dramatically reduced, the risk for them, right? If we prepare and have the support that we need. The bad things happen, the depression, postpartum depression, the sleep safety issues, all of these things, the negative things happen because the support wasn't there. And so let's just plan for support. It's not about fear mongering. It's about being aware so that you can plan ahead for the support that you need. And it's normal to need support during the postpartum period and beyond. Primal Parenting does offer a sleep membership and course that is based on attachment science and brain development, so that there is zero distress. There's no pushing the baby ever to be more independent than they're biologically able to be. So there's no cry it out sleep training, but there are a lot of ways to improve sleep and to shape baby's sleep and to shape the parent's life so that it's more conducive to getting the sleep that they need. And that is all covered in Primal Parenting's Smart Baby Sleep System. So if you're interested in getting support with sleep, that is a no cry, no stress, attachment friendly option for you to check out. And please do also check out Gold Coast Doulas online resources. There are a tremendous amount of resources that Kristen and her team have put together to point you in the right direction for the type of support that you will need in that postpartum era. In parenthood, we need our village, we need our community, and that's why it's the fifth baseline of primal parenting, or the 5 primal instinctive neurobiological needs of all human beings when we're born. So thank you again for joining us on this episode of Preparing for Birth with Kristen Revere. And please do check out her book, and please share this episode with an expectant parent if you know any, and you can save them a lot of a lot of angst and a lot of trouble by helping them just be aware of what they need to prepare for and for the very best start. And remember, throughout evolutionary history, throughout human history, we've had this kind of support. Human beings wouldn't be here today if we didn't have the equivalent of today. We have doulas, but we've always birthed with support. We've always raised children with support from other adults. So please understand, this is not something that you need to prove, how independent and tough you are at this stage. You give your baby the best start by giving yourself all the support that you need during this time. Even when it comes to breastfeeding, 90% of women are able to breastfeed biologically. Physically, there's no issues, but the breastfeeding rate drops to about 50% because of challenges that have solutions. So all of these challenges, they're not scary because they have solutions. There are solutions, and if you have the right support lined up, you will be able to get access to the solutions when you need them. So just understand, women have always birthed with other women supporting them. And for that last 10%, which is a debatable stat, okay, it's debatable, for the 10% that actually do have physical reasons that they can't provide breast milk, there are milk banks. So just be aware, by the way, there are milk banks. You can get human milk for your baby. So look into that. I'll put some links on how to find milk banks. And if you are able to donate to milk banks, that's an excellent thing you can do to provide community to other moms who are unable to breastfeed, because breast milk really is so critical, and formula should only be given as a last resort. So giving the baby human milk is accessible. It is not something that's widely marketed because there's no money behind it, but it is a viable option, FDA approved, and there are safety measures in place. So it is something that is a very credible and reasonable thing to do. So keep that in mind. If you do have any issues breastfeeding, please give us a share and a comment below. Let us know, what is the most important thing you did to prepare for your child's birth? If you're on the other side of this, let's share.